大家好，我是名冠诊所的耳鸣特别门诊李冠仪医师。今天我们要来分享一个从英国来的耳鸣患者。这位患者他已经受耳鸣所苦2年。那除了持续性的耳鸣，他还有伴随着脑鸣以及头痛。这些症状都严重的影响他的生活品质以及睡眠。他在英国的时候有做一些治疗，但是这些治疗都没有让他的这些症状获得改善。经过名冠医疗团队的治疗之后，他的耳鸣已经下降到原本的30%，他的生活品质也获得不少的改善。接下来让我们一起听听他来名冠诊所治疗前后的经验分享。
Tinnitus began about 2 years ago. I noticed it after 2 days. I used a nasal spray that I thought it could clean my ear canals. However, the GP is absolutely sure that would not cause tinnitus. Perhaps it happened just with coincidence. Okay, since my audiologist confirmed that I don't have any hearing loss and I have no problems in daily communication. However, when it comes to concentration and sleep, to say I'm struggling is just an understatement. I feel like, I don't want to say in this way, I feel like in hell. That's it. That's how I feel. I was so struggling in my sleep with nightmare. So especially in the morning, it's so torturous. No, it remained all the same with high pitch, buzzing like a cricket or somewhat like electricity. Noise is so debilitating because mostly it happened in my head. So I could even feel the sound wave moving around in my head. I couldn't accept that at all. Moreover, I have had bad headache and fullness in my eardrum. I have to take painkiller very often, and unfortunately the medicine the GP in NHS prescribed me almost didn't help it, even a tiny bit, even with my tinnitus-induced emotion. So I would say it was useless. Despite of changing different types of medicine, the psychiatrists in NHS still rejected the referral from my GP. So I would say tinnitus tremendously lower the quality of my life in all aspects. It's no joke. You know, seriously, honestly, I was willing to go and euthanasia if possible. You know, euthanasia is to inject you and then put you to sleep for some terminal cancer patient. But of course, they won't do it for tinnitus patient. By the way, I've got a wife, so of course I won't go there. I mean, I'm almost inclining to be so suffering to think of euthanasia. In Western worlds, I always would just hear tinnitus has no cure, or even a way to improve it or to relieve it. Then, therefore, I try searching some information in Chinese on the internet, and then I find this clinic with quite a lot of positive and promising reviews from Dr. Yuan's patient. Actually, I almost watch all the successful videos. Beside the credential and the testimonial from his patients, he has made a lot of effort to study regarding tinnitus treatment. With his extensive experience, I have great faith in his practice. So, because no one seems to be so willing and devoted to do that. That's pretty depressing. There is no treatment.
No treatment.
What I obtain is are, noise generator behind my ear. Okay, and when I sleep, I also have to wear it. But it really didn't help at all. My overall experience is truly amazing, including the nice staff and nurses. I still have like 30% of tinnitus, but it's a lot softer. It's less intrusive. And with Dr. Yuan's his prescribed medicine, I can live with the tinnitus with ease. So the tinnitus pitch is lower, and then I can say it's much more manageable. Well, at least I don't have to wear the noise generator 24/7. The most phenomenal is my sleep quality. My sleep quality, which is brilliant. I don't have any nightmare, and then I guess this highly contributes to the tremendous reduction in my tinnitus, especially in my head rather than in my ear. Since I'm a medical layman, so I know nothing about it, but I just can't say I feel all great about all the treatment, including injection or like electricity, static stuff, headphone, or like everything, like including the medicine Dr. Yuan prescribed, which was amazing. I would say if your ENT doctor can't find any underlying causes, please come to here immediately. For me, cognitive behavior therapy, CBT, or noise generator, just in my personal opinion, works like nothing. No offense, unfortunately, NHS can't even treat my tinnitus-induced mental disorder. I'm not talking about tinnitus, I'm talking about tinnitus-induced mental disorder. So I highly recommend people with tinnitus to come here to get some help. Of course, I would like to express my gratitude, tons of thanks to him and also to his devoted medical team and staff. Much appreciated.